Hello, next we are going to learn about the internal structure of the medulla oblongata. Now here the internal structure we will be learning by taking three transverse sections at three different levels. First at the lower level, that is at the level of the pyramidal decussation. Second at the middle of the medulla, that is at the level of the sensory decussation. And third at the floor of the fourth ventricle, that is in the upper part of the medulla. Now all these transverse sections that we are going to take, right, we will be learning it into two sections again, because we know that brain comprises of the gray matter and the white matter, right? So the areas of the gray matter and the areas of the white matter we will be learning differently at all the three transverse sections. Okay, one by one we'll be taking all. The first that you can see in the diagram, that is the transverse section through the lower part of the medulla passing through the pyramidal decussation. Now here it resembles, you can see it resembles the transverse section of the spinal cord, right, as it is also showing the three funiculi and some of the tracks that are similar to the spinal cord. Here in the white matter you will find the pyramids that are present anteriorly. Here you can see the pyramids, right? The decussation of the pyramidal tract, it is one of the most important feature that is present at this level. The fibers of each pyramid, they will run backwards and laterally to reach the lateral white column of the spinal cord, where they form the lateral spinothalamic tract. The fasciculus gracilis and fasciculus cuneatus, they occupy the broad posterior white, you can see here the broad posterior white columns, they are occupied by the fasciculus gracilis and fasciculus cuneatus. The other features in this white matter, they are almost similar to the spinal cord. In the gray matter you can see the decussating pyramidal fibers, they separate the anterior horn from the central gray matter. The separated anterior horn, it forms the spinal nucleus of the accessory nerve, this one, right, and the supraspinal nucleus of for the motor fibers of the first cervical nerve, right. Here you can see that. So these two spinal nuclei, they are formed by the fibers that are separating the anterior horn, right, the decussating fibers of the pyramidal tract. The central gray matter with the central canal, that is pushed backwards, right. The nucleus gracilis and nucleus cuneatus, they are continuous with the central gray matter. You can see here, this, it is continuous with the central gray matter. Laterally, the central gray matter is continuous with the nucleus of the nucleus of the spinal tract of the trigeminal nerve. A bundle of the fibers overlying this nucleus, it forms the spinal tract of the trigeminal nerve. So this is the nucleus and this is the tract of the trigeminal nerve, right. So these are the important areas that you will find at this transverse section of the pyramidal decussation, the areas of the gray matter and the areas of the white matter. Next is the transverse section through the middle of the medulla, that is at the level of the sensory decussation, right. The diagram for it is here, you can see. Here again we will learn first the gray matter. The nucleus gracilis and nucleus cuneatus, here if you observe, they are much larger as compared to the previous diagram, right. So they are much larger at this level and they are separate from the central gray matter. The fasciculus gracilis and fasciculus cuneatus are not seen here, so they end at this nuclei. Lateral to the cunate nucleus, you will find the accessory cunate nucleus is present. The nucleus of the spinal tract of the trigeminal is also separate, right. This is also separate from the central gray matter. The lower part of the inferior olivary nucleus, this area you can see, this is the inferior olivary nucleus. It is also seen in this section, only the lower part. The central gray matter, it contains, first you can see the hypoglossal nuclei, right, then the dorsal nucleus of the vagus and this is the nucleus of the tractus solitarius, right? In the central gray matter, 3 nuclei you have to identify. Hypoglossal nuclei, this one, that is the nucleus of the 12th cranial nerve. Then this is the dorsal nucleus of the vagus, and above all here you will find the nucleus of the tractus solitarius. Tractus solitarius, it is one of the descending tracts, right, which mediates especially the sense of taste and includes the fibers from the facial, glossopharyngeal and vagus nerves. That is about the gray matter at this level. Then comes the white matter. The nucleus gracilis and the cuneatus, it gives rise to the internal arcuate fibers, right? Here from the nucleus gracilis and cuneatus, you can see the fibers are emerging, right? So this are called as the internal arcuate fibers, and this internal arcuate fibers, they cross to the opposite side, right? You can see that, where they form a paramedian band of the fibers that is called as the medial lemniscus, right? So this is medial lemniscus that is formed by the internal arcuate fibers. In the lemniscus, the body is represented with the head posteriorly and the feet anteriorly. The pyramidal tracts, they lie anteriorly. Here you can see the medial longitudinal bundle, it lies posterior to the medial lemniscus. This is the posterior medial longitudinal bundle that lies posterior to the lemniscus. The spinocerebellar and the lateral spinothalamic tracts and the other tracts, they lie in the anterolateral area. Here you can see all the tracts that are lying here, right? So the spinocerebellar tracts and the lateral spinothalamic tracts, right? They are seen here in this anterolateral areas. So that is all about the gray matter and the white matter that you can see at the level of the sensory decussation or the middle part of the medulla. And the next and the last is the transverse section through the upper part of the medulla, passing through the floor of the fourth ventricle, right? This is the diagram. Sorry. Here in grey matter you will observe the nuclei of the several cranial nerves are seen in the floor of the fourth ventricle, right? Here you can see this is the floor of the fourth ventricle that is shown, and below that you can see the multiple nuclei are seen, right? First, the hypoglossal nuclei is seen in the paramedian position, right? The dorsal nucleus of the vagus lies next, that is lateral to the 12th cranial nerve nuclei. Then comes the nucleus of the tractus solitarius, venterolateral to the dorsal nucleus of the vagus. Then inferior and medial vestibular nuclei, medial to the inferior cerebellar peduncle, right? This is the inferior cerebellar peduncle, and medial to that you will find this vestibular nuclei are present. Next, the nucleus ambiguus. This is the very important nuclei, nucleus ambiguus. It lies deep in the reticular formation of the medulla, and it is very important because it gives origin to the motor fibers of the 9th, 10th and the 11th cranial nerves. The dorsal and the ventral cochlear nuclei, right? This is the dorsal cochlear nucleus, and this is the ventral cochlear nucleus that you can see above and below the inferior cerebellar peduncle. This nuclei receive the fibers of the cochlear nerve. The nucleus of the spinal tract of the trigeminal nerve lies in the dorsolateral part. This is the spinal nucleus and the tract of the trigeminal nerve. Both are lying in the dorsolateral part. The inferior olivary nucleus is the largest mass of the grey matter that is seen at this level. It is responsible for the elevation of the olive. Its grey matter appears like a crumpled purse, right? You can see the diagram. Close to the inferior olivary nucleus, there are medial and dorsal accessory olivary nuclei. The arcuate nucleus lies anteromedial to the pyramidal tract, right? Here you can see the arcuate nuclei that is anterolateral to the pyramidal tract that is present here. Okay. These are the parts of the grey matter, and one more important thing that you should know here is the visceral centers, right, that are present at this level. 3 important visceral centers. First, is the respiratory center, second the cardiac center for the regulation of the heart rate, and third is the vasomotor center for the regulation of the blood pressure. So these three centers are also present at this level. Next is the white matter at the transverse section passing through the floor of the fourth ventricle. It shows first inferior cerebellar peduncles, right? This is the part of the white matter. It occupies the posterolateral part that is lateral to the fourth ventricle. The olivocerebellar tract, right? Here you can see from the inferior olivary nucleus, a tract is emerging and going to the opposite side inferior cerebellar peduncle, right? So this tract that you can see here, that is the olivocerebellar tract that is going from the olivary nucleus to the opposite side cerebellum. Then next you can see in the floor of the fourth ventricle, you will observe some transverse lines are seen. They are formed by the stria medullars. Stria medullars, it represent the fibers passing from the arcuate nuclei to the opposite half of the cerebellum, right? That we will learn again in the floor of the fourth ventricle. And you can, in the side here, you can see in the anterolateral parts, numerous tracts are seen, right? On both the sides you can see the spinothalamic tracts, dorsal spinocerebellar tracts, ventral spinocerebellar tracts. All these tracts, they are present in the anterolateral aspect. They also form the part of the white matter at this level. Okay, so this is the part of the gray and the white matter that is present at the level of the upper part of the medulla, that is the floor of the fourth ventricle. Okay, last part is the applied anatomy of the medulla. Clinical anatomy or applied anatomy, right? First is the medial medullary syndrome, right? Medial medullary syndrome, it occurs due to the blockage of the anterior spinal artery. Now it may be because of the blockage, and the blockage may occur because of thrombosis, right? That is the commonest cause. Anterior spinal artery, it is one of the branch of the vertebral artery, and if it gets blocked or if it gets thrombosed, right, then the following features can result. As the name suggests, anterior spinal artery, it is an artery that supplies the anterior part of the spinal cord, right? So if it is affected, it will produce contralateral hemiplegia due to the damage to the pyramid of the medulla, right? We have seen the pyramidal decussation, means the right sided pyramidal tract fibers goes to the left and vice versa. So because of this, not the same side, not ipsilateral, but the contralateral hemiplegia is the result here. Okay, so contralateral hemiplegia due to the damage to the pyramid of the medulla. Next is the loss of the sense of the vibration and position due to damage to the medial lemniscus, right? So this is the function of the medial lemniscus, the sense of position and vibration. So if it gets damaged, that sensation is lost. Paralysis of the muscles of the tongue on the same side due to injury to the hypoglossal nerve. Next is the lateral medullary syndrome. It occurs due to the blockage of the posterior inferior cerebellar artery. Again, the thrombosis of the posterior inferior cerebellar artery leads to the lateral medullary syndrome. It is the largest branch of the vertebral artery again. Features are ipsilateral paralysis of the most of the muscles of the soft palate, pharynx and larynx due to the injury to the nucleus ambiguus. We have already talked about this, that nucleus ambiguus is a very important nuclei that gives origin to the motor fibers of the cranial nerves 9th, 10th and 11th, and if they are damaged, it will result to the disturbance of the motor function of the soft palate, pharynx and larynx. Loss of pain and temperature on the same side of the face due to involvement of the spinal nucleus and spinal tract of the trigeminal nerve. As we know that the trigeminal nerve is the sensory supply to the face, right? We have already learned this. So loss of the pain and temperature sensation will occur here. Then loss of the pain and temperature on the opposite side of the body due to involvement of the lateral spinothalamic tract, right? If lateral spinothalamic tract is involved, it is loss of pain and temperature sensation but on the opposite side of the body. Giddiness, that is similar to vertigo due to involvement of the vestibular nuclei, right? That we have seen in the last diagram. Next is injury to the lower part of the medulla oblongata. It may be very fatal because this area, it contains the respiratory and the vasomotor centers, right? So respiration and the cardiac function, the regulation of the blood pressure and the heart rate, these are the two very vital functions of our body, and if they are damaged, so it can be a very fatal for the human life, right? So injury to the lower part of the medulla oblongata is very fatal. With this, we complete with the medulla oblongata, and your assignment is that you will draw all the diagrams, colored diagrams, 2 times in your anatomy notebook. Okay, that is your assignment for medulla. In the next video, we'll learn about pons. Bye.